Excellent. And that one will wait until there's Q&A.
Yeah.
Save the mic. All right. It's on now. All right. Great. Super. Thank you, everybody. Yeah, so we've heard a lot about Lyme disease, and we've heard a lot about prevention and diagnosis and education. And we're going to hear in the next segment of our program from patients, 4 of them assembled here up front, patients who have suffered from Lyme disease in one form or another, and for differing lengths of time. And by the way, this was supposed to be a 5-seater table. There was a 5th. You'll see her in your program, Jamie Sewell. She had a health setback, which is not uncommon among Lyme patients, and was unable to join us today. So it's 1 down and 4 in front of us. I'm going to introduce them one at a time, and as I've introduced them, I'm going to let each of them tell a brief story, 3 to 4 minutes, about their journey. And then I've got a few questions for each of them. And then my hope and belief is that all of you, or some of you, will have your own questions for these patients after they've told you their story with Lyme and other tick-borne illnesses. Ryan Maness is one of the luckier ones. We'll start with him because in 2017, after being told to disregard a tick bite, he went to the emergency department following a fever that had spiked to 104. And within a few hours, he was told that his immune system had been eradicated. He can explain that for you. Fortunately, though, for Ryan, doctors were able to put him on antibiotics quickly thereafter, and he was symptom-free. So we'll start with the better of the 4 stories. But Ryan, how did you get there, and how are you doing today? Ryan Maness, everybody.
Thank you, Dan. So yeah, my name is Ryan Maness. I was swimming at the Y one day and noticed a tick on my inner thigh. Freaked out, immediately called my doctor, and my doctor said, "You're probably fine, take it off, whatever." About 2 weeks later, being about 35 years old, believing myself essentially invincible, I noticed that I was just feeling very run down. Went to work as normal, but then by the end of the day, even I couldn't deal with it. I had to go home. By the next day, my fever was going up and down. I was feeling deeply terrible. And when it was only actually, my wife is sitting to my left, it was only after I had, again, spiked to 104 the next morning, nothing was getting better. I was finally convinced to go to the emergency department, the first time I'd ever had to go to the emergency department for myself in my entire life. I told them as soon as I got to the ER that I had been bitten by a tick, but they did one test on me for Lyme, said, well, it's not Lyme disease because you tested negative, so we think it's probably mono. And I said, that seems very strange, but I don't know anything and I'm feverish and delirious, so sure, let's go with that. I was in the emergency department. They ran a gamut of tests over the course of about 6 hours. However, by the time again, having gone to the ED that morning around 9 a.m., by about 5 o'clock that afternoon, I was put in a 0 pressure room and was told that I essentially had no immune system to speak of. It was at this point, they were sort of almost seemed to be lacking any other options. They put me on IV antibiotics, and I was essentially almost fully recovered, at least in my presentation in my own body, by the next morning. But it was an incredibly scary time to go from 0 to extremely sick, especially for, again, someone who had never battled any sort of significant illness in myself at any point previously. To have that happen so quickly, it was like just being shot out of a cannon. I'm very, very fortunate that after that initial run of antibiotics and then oral antibiotics when I got home, I have suffered no long-term effects from this other than a lifelong hatred for ticks and a fierce desire to be an advocate on these issues.
Ryan, thank you. IV and oral antibiotics to the rescue, but just in the nick of time. Thank you. You said your wife to your left. I mean, hi, Virgie. Yeah. Next, it's a family affair because Virgie Townsend is the director of public relations at Strategic Communications. That's a PR firm in Syracuse here. She's worked in healthcare communications, ironically enough, for 18 years and recently joined the advisory board for the CNY Biotech Accelerator. She feels right at home in this room and in this building. She also is the author of a collection of short stories. Her nonfiction has been published in the Times, the New York Times, that is, the Washington Post, Harper's Bazaar, and other outlets. However, in the summer of 2022, just a year ago, Virgie lost her cousin to cancer. She developed neurologic Lyme disease and she had COVID, all within the same 6 weeks. She didn't see a tick, didn't see a rash of any type. Unlike many Lyme patients, though Virgie was tested early, the test was negative, and then the test wasn't repeated, delaying a diagnosis until she was hospitalized 1 month later, and she was told the possibility at that point was either MS or lymphoma. The combination of her cousin's death, sister's very close guy, wasn't just a cousin, she's like a sister to you, right? A beloved cousin, someone she loved like a sister, died suddenly. Then she lost her own health. And that resulted in a life-threatening episode of depression. But she comes to us today to tell us a little more about her journey and where we stand today. Virgie Townsend.
Yeah. Thank you for having me here today. Honestly, that's the sort of the long and the short of it in many ways. I can get into details about the month that it took to get diagnosed. But I would say certainly one of my big takeaways from that is when in doubt, retest, because I was tested on day 5 when I developed facial paralysis and it was negative. And at subsequent appointments with a neurologist, they asked, could it be Lyme? Did you see a tick? And I hadn't seen a tick and I had been tested. And at that point, we all wrote it off. And there was further misdirection because I had previously had true Bell's palsy following the birth of my first child with preeclampsia. So we all thought we understood what was happening with me neurologically. And by the time an MRI was done, I was told that it appeared that I had either cancer or a very severe infection, including lymphoma, MS, or sarcoidosis. And had to go to the emergency room urgently. And as you can imagine, this was highly traumatic because at that point, my cousin had just died 6 weeks before at the age of 31. And I was in terrible shape, both emotionally, grieving extremely deeply, as well as then physically. And I'm very grateful to my husband and to our 2 children for giving me the hope and the strength to continue on through the loss of Tarly and the significant calamity of having Lyme disease shortly thereafter.
You got your own family support group there, fortunately, built right in. Coming down right to left on my side of things, Dr. Adam Seegers will be next. We'll set the microphone up to him. And he obviously comes at it from both points of view, and he's got quite a story to tell, and I'll let him tell it because he's a doctor with the South Louis Health System, and he's also a patient. You can hold that right up to your mouth if you want.
Sure. Can you hear me?
I can. Back row. Can you hear Dr. Seegers?
Perfect. So I've been a physician, primary care for about 15 years, and I had a co-infection with anaplasmosis and Lyme disease. I attended the conference last year, learned a lot of things from that. One of the things I learned after having the Lyme disease and the anaplasmosis, it's kind of a humorous story, but I decided I didn't want to get Powassan virus. So I decided I was going to pick up a side hustle at my house and I was going to catch all the woodchucks. So I've caught every single woodchuck within a mile of my home and I've relocated them. But the problem is that I didn't realize is that woodchucks, they're diurnal. And I left my traps out because my day job got in the way of my side hustle. So I've caught about a dozen skunks. So I've gotten really good at singing skunks to set them free as well. But with all seriousness, though, I mean, a couple of years ago, we were on a family trip. And basically, we'd been up at Cranberry Lake. We had a long weekend. And I was feeling really tired. I was out for a run and I just couldn't get back. I was just exhausted. And I went to bed that night. And I had some of the most drenching night sweats that I think I'd ever had. And I thought, oh my gosh, I've got lymphoma. Something bad's happened to me. And I took some ibuprofen. I didn't want to ruin the family vacation and waited till Monday morning. Went to work. I was really achy, really stiff. I tried to get through work, but I said, you know what, I'll go to the urgent care tonight after work because, and it was right around the time of COVID. So the provider that examined me did a single point cardiopulmonary examination, which if any of you haven't seen one of those done, I did. I was really not very impressed. No history was taken. And I was told I didn't have COVID and I was discharged home. After that, and by the way, that provider knew I was a physician. After that, I decided I was going to wait till my primary care got into the office. He wasn't going to be back until the end of the week. So I continued to go to work. I tried to get through the day, but my neck was getting progressively more stiff. I wasn't able to bring my chin to my chest anymore. I had a swivel chair, so I would turn and, kind of go back and forth, and I noticed that my muscles were hurting, my joints were hurting. And then towards the end of the week, I noticed I was having a lot of trouble with word finding. I talked to patients, but it was really challenging. I was really struggling, and it was taking me over twice as long to do my notes. And at that point, I realized something more serious was going on, and I wasn't thinking straight, but I knew enough that I needed to get myself to an emergency room. So I did, and I'm kind of a cheap guy. So I paid a $200 copay. That was the best $200 I think I've ever spent in my entire life. If it would have been more, I would have gladly paid it. They had done some blood work there. I was found to have low platelets, low white cell count, and elevated liver functions, and I had flipped my T waves. I was having this crazy flip-flopping feeling in my chest. And I should mention that I didn't even dare go to sleep because I was afraid something terrible was going to happen to me because it was just so uncomfortable. The ER doctor consulted with the ID doctor, made a presumptive diagnosis of anaplasmosis. All of my testing was negative. I was kind of thinking as a physician, it would be cool if, maybe you could just order a PCR tick panel and then you'd know all the diseases. And I said, wow, why haven't I known about this? So of course it came back negative. But also the ER physician gave me the option if I wanted to do a lumbar puncture. Now, as providers, I think you probably would say no if somebody asked you if you'd like a lumbar puncture. So when somebody has, Lyme meningitis, Lyme carditis, it's probably you just do it, tell them it's necessary and do it. But anyway, I was discharged home because I was a physician. My wife's a nurse. He said, you'll be fine. And I got home and I was anything but fine. I then spiked fevers up to 105. I had the most horrific sensation that I think I can ever describe. I felt like I was going down a tunnel, a black tunnel, and things were zooming past me as fast as I could imagine. And I didn't know what to do. But I knew that it wasn't good. I knew a fever of 105 wasn't good. I was rigering and I couldn't stop it. And I said to myself, oh my gosh, I've got to get cooled off. And I basically ripped off my clothes. I ran out to my car and I turned the air conditioning on as hard as it could go. And I sat there until my fever came down to 102. And mind you, I'd been taking ibuprofen regularly because, of course, doctors are not allowed to get sick. Nobody gets sick days. They're vacation days, guys. So basically at that point, I got my temperature down to 102. I went inside. I wrote down all my financial information for my wife, my passwords to my bank accounts and everything. And this proceeded for the next 24 hours of these 105 fevers. And it was pretty bad. And then basically the next couple of days, I got so weak and so short of breath that I wasn't able to walk up a flight of stairs. And I thought I was doing better over the next couple of weeks, but the symptoms really took a while to fade away. At 2 weeks, I completed my 2-week course of doxycycline, which is what they gave me. And basically then I ended up with a Bell's palsy. And then I knew, of course, that I had Lyme disease and had to take another month of doxycycline. And I do have still some persistent symptoms that have been ongoing. But
Well, that's a book's worth. Adam Seegers, we'll be back to all these guys with follow-up questions shortly, but the other woman in front of you heard from yesterday, and most of you probably know her already as the executive director of the Central New York Lyme and Tick-Borne Disease Alliance. But Royale Scuderi started her battle a good, 13 years ago. Didn't have any apparent rash, but has, like the others, had a long history of misdiagnosis, long diagnosis, health decline. And then she was finally diagnosed with late stage disseminated Lyme and babiosis, but she lost a lot of time out of her life, out of her work, $60,000 some odd dollars and counting in debt because of the medical burden for her and her family. And she still struggles with post-treatment Lyme disease syndrome to this day. But she's dedicated her life and her career to being a champion for others in her role with the Alliance. Royale Scuderi, the microphone is yours.
Thank you. Thank you, Dan. So as Dan mentioned, I'm the executive director of the Central New York Lyme and Tick-Borne Disease Alliance, but that is not the career I had planned. My journey began back in 2010. So it's been 13 years now. As Dan mentioned, one of the many who did not see a tick, did not get a rash. So we have no idea when I was bitten, when I contracted the disease. I didn't have severe acute symptoms that I recall, which I feel like my story is sort of like everything that can go wrong, that goes wrong, you know, so I didn't have that. If I did, we wrote it off as a virus or a mild flu. I didn't go to the doctor, nothing. During fall 2010, I started noticing worsening fatigue, headache, joint pain, all the things that I now know would send me to the doctor for Lyme disease, but we didn't know. We didn't talk, it wasn't talked about, it wasn't on the mind in 2010. It wasn't something I was thinking about or my doctors were thinking about. Later that winter, I started developing cognitive issues, memory loss, serious mental health issues with a primary diagnosis of bipolar and OCD in my 40s, which again should have been another red flag, but wasn't. And so I went to, then later after that, and by spring, I started developing intermittent fevers, chills, shortness of breath, stiffness of neck. I could, like Adam, I had run half marathons. I was winded carrying the laundry up the stairs. I said, something is seriously wrong. I had been to so many doctors, so many tests. No one even considered tick-borne disease. Just wasn't even on the menu. But I had a string of misdiagnoses. It's rheumatoid arthritis, despite the fact that I was negative for all of that. It's MS, despite the fact that my MRI didn't look like an MS. Fibromyalgia, chronic fatigue, it must be. We have no idea. Throw up our hands. We don't know what to do with you. So finally, I stumbled upon, just lucky, a doctor who, in Little Falls, of all places, I had to drive over an hour away, but she suspected Lyme disease right away, ran the tests. Luckily, I was positive by the ELISA and Western blot. I was treated. She gave me 2 months of doxycycline, which I now know is generous. But I had been suffering for so long, she figured I probably needed more than the standard 3 weeks. I did see some improvement, but I really didn't recover as expected. And so, as Brian mentioned, just a short while ago, she began to suspect a co-infection. And my symptoms, the later symptoms that I mentioned, are typical of Babesia. Definitely in a malaria type symptoms. So we realized I also had Babesia, and having that co-infection along with Lyme for such a long period had really made the diagnosis and treatment much more complex, because I just had this extra constellation of symptoms that looked different. And so it really complicated everything. And also I now have learned it made it so that I didn't recover as I should, right? Because I had these two separate things. At any rate, at that time, back in 2010, 11, local doctors didn't have experience treating Babesia. They didn't know what to do with it, really. A month of Meprin, but they didn't really know what else. So I ended up driving to Long Island, where we have family. My husband is from Long Island, to a primary care doc. But down there, 90% of his patients have tick-borne disease of some sort. And he's been treating these patients for decades, because it's just been such an epidemic down there for so much longer. And so I had to drive to Long Island for nearly a year for treatment with antimalarials, Meprin, yellow paint. If anybody has ever taken it, it's disgusting. And rotating antibiotics, because at that point we had gotten into summer and I had the sun rash. And so we were changing the antibiotics that were necessary. After a year, I the acute symptoms did resolve. I started feeling much better. As a side note, in that time, I didn't really see significant improvement until we started adding in some adjunct herbal adaptogens, vitamin supplementation. We tested everything. We realized my vitamin D was in the tank. You know, there were other things that I was missing, and lifestyle changes. So we were basically doing everything we could to help me support my immune system to do its job, and cutting out all of the things that were interfering with my body healing itself, essentially. We threw everything with the kitchen sink at this, and it worked. So I started feeling significantly better. But the diagnosis and treatment took 2 years. And then another 2 years regaining my health capacity before I could go back to work part-time, and then eventually full-time. So I went from, as I said, 40-year-old mother of 4, successful professional, ran the Boilermaker, running half marathons, active, physically fit, to bedridden. Had to give up my career because I couldn't remember words. I was a freelance writer at the time and consultant. Couldn't find words, couldn't make complete sentences. So I lost all of that. As Dan mentioned, we ended up $60,000 in debt. I lost several years of work time, missed parenting my children, which was a struggle, as my husband is in the military and I was often a single mom, 4 kids. It was hard. And all of that with top tier health insurance and an active support network, and resources. So, my heart breaks for everyone who doesn't have the advantage of great insurance, a husband who can drive me to Long Island, family down there, people to help out with the children, access to information, knowing how to be a patient advocate, which I unfortunately learned when my father had a cancer battle, and I learned how to navigate the healthcare system. That's a privilege that served me well. So this could have been so much worse without those resources. So over the last 13 years, I have regained much of my health. I'm fully functional. I do this job full time, and I have my life back, but I'm still one of the many post-treatment Lyme disease patients who never quite fully recovered. And so though I'm fully functional, the damaging effects of the disease linger today, right? I still have terrible arthritis. My memory never completely recovered. And I have kind of what I would classify as health endurance issues. If I get sick, it takes me a while to bounce back. Yesterday, I will be frank, I texted some of my other planners. I was wiped out. I went to bed at 7:30 and I slept for 10 hours. It's just a lot. And so it sort of sapped me. It just has permanently. But that's my story, Dan. It's a long one.
And you're sticking to it. And I'm glad you did. And I'm glad you stuck with the Alliance, because that's the type of leader we need at this Alliance. And that's why we're all here today. I'd like to start the questioning, because this seems to be a common theme with Dr. Seegers. As a clinicians, I'm asking you directly, and maybe it'll resonate with the others in the room. It occurs to me, how would you suggest we could improve the diagnostic abilities, as with the experience you've had and what you've learned, and at the same time try to upgrade the doctor-patient relationship when it comes to early diagnosis?
So the first thing I would say is, when you walk into a room, you don't say, "What can I do for you today?" That's what they say at Dunkin' Donuts. "What can I do for you today?" "Yeah, I'd like a coffee and a bagel, please." You say something along the lines of, "Gosh, I talked to my nurse. I reviewed your chart, and I understand you're not feeling very well today. I'd like to hear your story." And then you shut your mouth. 30 seconds. Try not to talk. It's really, 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 really challenging to do that. And then, and I know we all think we don't have enough time in the visit, but what you'll find is that actually, when you do that, the story will come out on its own. And a lot of providers, what they try to do, I think, at least in my experience, the ones I've seen, is they'll try to tease things out of you. "So when did it start? How long did it last?" And that's all great, but the patient will tell you the story. And it's interesting too, you'll start to read between the lines. You may start to realize there are other problems. And I know everybody says again that there's not enough time, but as primary care providers, I don't know if you guys have ever looked at the statistics on it, but on average, we bring in $1.5 to $1.9 million per provider to downstream revenue for a healthcare system. So when your boss tells you don't have enough time, you need to see more patients, I think that's kind of an important statistic because that's almost as good as any of the specialists. And I think that what I'm getting at is, you know, when you go into a room, you ask open-ended questions, right? You go in and you say, gosh, you know, what's been going on? And you can ask some close-ended questions if the patient's really divergent, but you don't want to speak in absolutes. You know, you don't want to say you definitely don't have Lyme disease or you definitely don't have babesiosis. And I find that it's interesting when patients go to a tertiary or quaternary care center. To me, sometimes it seems like they get better care. And I think, why could that be? I work in a very rural setting. And I think a lot of that's students. I mean, as students, we're very good at expanding our differential diagnoses. We tell everything that it could and couldn't be. And then when we go into either private practice or work in a community hospital, many of us, we lose that ability and we have this what's called premature closure, where we already know the diagnosis. It's Lyme disease, or it's not Lyme disease, or it's got to be this, that, or the other. And I think one of the things that I found very, very helpful is that instead of, if I don't have the ability to have students where I work all the time, so I use the patients as the students. And essentially, one of the things you can do is you can tell your differential diagnosis to the patient, and they really like that. You put it in layman's terms, you know, this is why I don't think you have this, and we're going to do this test, which will show us that. And patients love that. And I think that, you know, by asking open-ended questioning, by sitting there and listening, by when you walk into the room, you basically, you know, you don't have the diagnosis already before you go in. That helps with one of our major downfalls, and that's empathy. And you say, well, what do you mean? I have empathy. Well, really? Okay. So I, who have both my parents, do not understand what it's like to lose a parent. So I can't be empathetic to that. I can try, but I can't. If I've never been chronically ill, or if I've never been sick, I don't know what it's like to be sick. And I think it's very, very important that we can kind of compensate with these other factors. But I think it's also really, really, really important that we realize that right now as providers, we're in the driver's seat, and that someday we're going to be in the passenger seat, and somebody else is going to be driving our car. And I think we need to really make sure that we're driving the car the way that we want it when we're the passenger.
Thank you, Dr. Seegers. Virgie, you were tested early, you said, and it was negative. So, and the test wasn't repeated. Is there anything that you have learned about your experience that you might suggest that clinicians could have? I know a lot of this sounds like Monday morning quarterbacking, and it's Friday morning, but you had the experience. What would you share that maybe could have been done sooner to make you less sicker sooner?
Yeah, I think it would have been helpful if the healthcare providers caring for me had kept in mind that we have this huge gap in diagnostic tools. I think I probably had a lot of classic signs of Lyme. I had these incredibly high fevers and voluminous sweating and chills, and then the palsy. And still, because that test was negative, it just got written off. And that ultimately was a mistake, because by the time I was correctly diagnosed, I was a month into being severely ill and had caught COVID from my husband's work travel, and my son had COVID as a 2-year-old. So more and more life happened during that month that then made it even more complicated and more challenging.
Yeah, and quickly, Ryan, because you were self-described as one of the luckier ones, for sure. You spiked the fever, you went to the ER, and they said that, you know, you needed some help right away. You got the help and you got better fairly quickly. Any words of advice you could offer to help others get that same experience?
No, absolutely. I mean, the problem is that when I was in the emergency department, again, my wife was at home taking care of our young children. So I was, you know, trying to be the best advocate I could while suffering from 104-degree fever. So when, and I, again, having never really been that ill before, was, very trusting and like, well, I didn't go to medical school. I failed biology. So I'm just going to listen to people who are much smarter than me. Unfortunately, when they told me that it was, something wrong with, every other part of my body, but a tick-borne illness, despite me saying, I found a tick on my leg and I pulled it out. And but they still were saying, no, we tested you for Lyme, so it can't be that. That was just incredibly frustrating that it took that long. And also, if you'll forgive me, another part of my wife's story is just simply that after Virgie was battling with Lyme, I had already gone through my journey. So I was already in a place where I was checked every day in the summer. At the end of the night, my closet door is open. I have a mirror on the inside, and I would check my body for ticks every single day from Memorial Day to Labor Day. And Brian would probably say I should have done after Labor Day too, but baby steps. Even still, for as vigilant as I was, I had started working with the board. All of that information that I had, I still, when they came back and said it's not Lyme disease, I'm like, well, I guess that's right. Like, I thought it was Lyme, right? We thought it could be a tick-borne illness. But even with that information, my wife works in, public health, so she knows how to be a patient advocate. She's done amazing work with my son, was very, very ill when he was first born on an unrelated issue. She knows how to navigate the system. I knew about these issues. And even with this, with all of that privilege, as Royale pointed out, with all of that privilege, we still got to this point.
Which makes Dr. Anderson's point about health equity even more important as we pursue these issues. Quickly, Royale, one takeaway for you for clinicians, because I want to press this and then move on to a couple other questions, then open the floor.
Sure. I'd say ask about exposure. That would have helped me. Outside activities, lifestyle. So it's routine. Every single time I go to the doctor's office, I am asked whether I drink or smoke. Every single time my children would go to the doctors, they were asked about lead exposure, or I were asked that, right? In Central New York, we have a tick problem. So we should be assessing risk exposure for tick-borne diseases. Had anyone asked me, I could have shared that I was a gardener, that we had a dog, that I was a hiker, that I lived in a suburban country. I lived in Wamsville, for crying out loud, right? So that could have been information that would have been useful if the question had been asked. So I suggest that should be top of mind for risk assessment when you're thinking about exposure to all kinds of diseases. Add it to the list, right? We're thinking about COVID exposure and all of these things. Add it to the list, right?
Before I open it up to the clinicians, a couple of questions to reverse the coin here for each of you. I'll start with Ryan. We'll come on down the table this way. What's the one thing or two things that you wish Lyme patients would know? In other words, someone who's early diagnosed, whatever, what would you give, based on your experience, advice to someone who either suspects they have it or has been diagnosed? Advice for the patient.
Very, very practically, I say this to friends all the time. If you have a strange fever that no one else in your family or your household seems to be getting, even if you didn't see a tick, even if you didn't get a rash, you should really, assume, if you live in this area, that a tick-borne illness is highly likely. If it's lasting for more than a day or two, and again, there's no one else in your household who might have gotten sick too, that's my first. I go to your doctor and ask for some kind of antibiotic.
Virgie?
Yeah. I had no clue that Lyme disease caused neurologic symptoms. And again, it was particularly confusing to me because I had had Bell's palsy following the birth of a child. So being familiar with both the common symptoms as well as the more unusual ones, I think is really important.
Adam, you're not a doctor now, you're a patient. What's your best advice?
My best advice is if you have a tick and you don't get a bullseye, that doesn't mean you don't have Lyme disease.
Royale.
So few things. Be your own advocate. Listen to your body. If something doesn't feel right, it's not right. And help your doctor by being prepared. Document your symptoms. Document when you think, if you think you might have been exposed, document. document your symptoms, your medicine, your lifestyle changes, come with this list and questions. You have a short amount of time. Let's help them. Give them the most information that you can. It's very different to say, oh, well, I'm not feeling well. But if you can go in and say, okay, I started having these symptoms on this day, and then I had these symptoms and they lasted this long, this severity, I think that you're giving your doctor as much information as possible. And I think that just helps both of you.
All right, I do have a few more questions for this panel, but I'm guessing that some of you also have questions. So I have one of these in my hand. If you raise your hand, we'll bring this to you. It's the lavalier microphone. Just hold it up to your mouth.
Hi, Lauren Edline, SUNY Upstate. First, I regret Jamie not being able to be here today. She's one of my Lyme patients, and I've learned a lot from her story. This question is for Royale, sort of in particular. I'm a primary care provider and a clinical herbalist at Upstate. So I treat a lot of Lyme patients in my practice from both perspectives. And in a totally selfishly motivated way, I'd love to hear more about which treatments you felt were the most beneficial for you. And if that's a long list and you'd like to connect afterwards, that's also fine.
Sure. To clarify, you mean in addition to, so I did take traditional antibiotics and antimalarials. In addition to that, we had added in, my doctor in Little Falls had some herbal experience. Yeah, it was Julie. Yes, everybody knows Julie, if you know Julie. I lucked, as I said, I lucked upon Julie, who was a Harvard trained MD, but also functional medicine doctor trained. So I had the best of both worlds, and I didn't even know that I had slid into the lucky pot there. Anyway, so she had recommended teasel root, and then we pulled some things out of the Buhner protocol, like Japanese knotweed, knotweed, cat's claw, those sorts of things. They were basically things that there was eons of use in other countries, and that there were no contraindications to my situation, and had a really good safety protocol. So even with that, I did a lot of research myself, read the books, and then talked to my doctor, and we thought, okay, well, these are some things that there's not really a downside. Let's try it and see if it worked. And then along with that, some adaptogens that those doctors, and in my recovery, Dr. Nanavati at Integrative Medicine at Upstate, who was my partner and who knew a little bit about non-traditional medicine. We also did rhodiola, ashwagandha, some adaptogens that were good for my immune system. So it was sort of things like that.
That brings me to the next question, because I'd like each of you, if you did use adjunct or non-traditional treatments or therapies, I assume maybe you all did. Ryan, maybe not because you got fixed so soon. Virgie, anything that may have worked outside the mainstream of medicine that would be interesting for this group to hear?
Yeah, so I both have undergone traditional facial PT with electrical stimulation as well as acupuncture, and I have found both helpful. I will say about traditional PT and the electrical stimulation, it's extremely painful because of the current that runs through your body when they put the patch on one's arm, and acupuncture is perhaps a little less effective, but much less torturous. And I'll also note that I do continue to have facial paralysis. I've not been able to raise my right eyebrow or involuntarily blink since June 26th of last year. So almost 16 months now.
Adam, anything non-traditional that's helped you along the way?
I don't really particularly use any supplements too much. I take vitamin D on a daily basis, but I did that before. I eat flaxseed every day, ground flaxseed. I've done that for pretty much my whole life. I mean, in terms of other things aside from exercise, no, I eat organic, have done that though before this. So I didn't really change that. And I've been vegetarian since '99, so I didn't change that either.
All right.
So I was kind of doing everything I thought I could be doing before.
Doctor, heal thyself. Physician, questions?
I'm
please.
going to laugh
Yeah.
and say my answer to that, in addition to those things, is I'm sort of the opposite of Adam, which goes to show we are all individuals, right? And we need personalized care. So what I have found to be the most helpful in this journey, non-traditional treatment, I would say, are dietary changes. seriously dietary changes. So no sugar at all and a low carb diet. I am almost ketogenic. So the opposite end of the spectrum from Adam, but that completely lowered my inflammation. It's gone. And it actually, at this point now, manages my mental health. So, you know, it's kind of like a tangent, but the ketogenic diet manages my bipolar, just like epilepsy. So everyone is different. So I think that's why it's a hard question.
Well, yeah,
Right.
for what it's worth, my son went gluten-free because he was advised to, and that got rid of almost all the brain fog, almost overnight. But it didn't fix everything. Questions, please, from you guys. Right up.
Hi, Christina Beam. I'm an extra school nurse in Fayetteville. Virgie, I just have a question. You were tested for Lyme and it was originally negative. How did you get your diagnosis of Lyme then?
Yeah, so the fevers continued, but eventually got a little bit better. But the neurologic symptoms, even after a treatment of steroids, returned. So I had the facial palsy, didn't have a lot of pain with it, got steroids. They seemed to work. And then about a week to 10 days later, the facial paralysis returned, but this time with excruciating pain behind my ear and through the whole right side of my face. And that was the inflammation of my cranial nerves and them detaching from the nerves and muscles in my face. And at that point, my GP, who had been treating me, said, this doesn't look like standard Bell's palsy anymore, and told me to go see a neurologist. The neurologist was the person who initially wrote off Lyme disease because I had been tested previously, but ordered an MRI. And at that point, the MRI came back with significant abnormalities and led to the possibility of lymphoma, sarcoidosis, or MS, and told me to go straight to the ER. Now, the challenge is I couldn't, or I'll rephrase, I did not feel comfortable going straight to the ER once they got the results, because at that point I had COVID and my 2-year-old had COVID. So that delayed things by about 5 days because my son had previously been on a ventilator with RSV. And so I did not want to leave him until he was COVID negative. And when he was COVID negative, I then went to the hospital. They ran a battery of tests. At that time, not even all of my Lyme tests were fully positive. Only about half of them, to my knowledge, were positive. And the neurologist said that what made my case tricky was it appeared that the Lyme disease had somehow essentially bypassed my immune system and gone straight for my cranial nerves and my central nervous system. And I still don't know why that would be. I can say, again, I was grieving extremely deeply, and I would imagine my immune system, because I was waking up multiple times a night, mourning my cousin, was probably not in the best shape. Because again, Lyme occurs when you are living the rest of your life. Other things are happening, and all of a sudden you are violently sick.
My question is for Virgie, and I just wanted to know the name of the provider that you received the facial PT and electrical stimulation.
Yeah, I went to Mary Lou Corcoran, PT, and I saw Rob. And he, I think his last name is Wolf, and he specializes in facial PT.
We have a few on Zoom. Go ahead. Is it? Oh, he'll need a mic. Don't say anything till I'm in front of you. Everybody's got to hear it. Plus, I've forgotten to tell all of you to identify yourself before you ask a question, but so be it. Keith?
All right. This question kind of harkens back to the discussion about primary care and patient advocacy. Bill Mitras on Zoom was asking, his daughter is a nonverbal autistic. Are there steps and procedures to better serve people that may have a disability or difficulty in communicating that something may be wrong?
Oh, wow. I don't know if that's more for the up doctor.
I could try to answer that. Sure. So I think that there's a really good book that I would recommend maybe that you read. It's How Doctors Think by Jerome Groopman, Groopman. And basically in that particular book, I mean, if you think about the way that information is presented to a provider by a patient and the way that we take that information and assimilate it into a diagnosis, it can be very different. And so like to Royale's point, she had made the comment about how when she goes to the doctor, she presents it in a logical, chronologic fashion. That's very helpful. I mean, we all know that. But a lot of times patients will say, well, I have this, I have these symptoms, you know, I have a Bell's palsy and I started feeling crummy a few weeks ago. And I do have fevers now too. And you're like, oh my gosh, you know, it jumps all over. So I think especially if somebody is nonverbal or autistic, I mean, you're going to really need to present that history on their behalf. And I think if you can present it in a way that the provider is going to be expecting it, it's more helpful in getting assistance.
How about another question there from Zoom? Oh, okay. Who else out there while we're waiting for Zoomers to come on, and anybody else? Question for the panel or a comment on what the panelists had to say? I mean, they've had a lot to say to you. Maybe you've got something to say or to ask them.
Hi, I'm Kim Pham. I'm just wondering for you guys, any long-term mental health effects that they touched on yesterday, and then also for Royale, the bipolar disorder, are they thinking that's related to the Lyme or completely separate?
I mean, I think Brian did a good job of this yesterday. Brian Fallon talks about this a lot, but yes, the long-term impacts, the bipolar is absolutely from Lyme. Again, the doctor in Long Island didn't bat an eye. I had, through this journey, been referred to a psychiatrist, and I was diagnosed with bipolar and OCD symptomology as a female in my 40s. That should have been a red flag. That is very, very uncommon. And he said he saw it commonly down there, a mental health sort of symptomology, especially when you're in the later stages and it gets into your brain. And I had documented white matter changes on my brain. There was physical evidence that there were brain changes that honestly, if you read the report, it was like white matter changes consistent with aging. And then we got the actual MRI and he said, if you're 60, I was 40 at the time. So there was that. So it was definitely caused by the Lyme bacteria. But that said, once the physiological, biological damage is done, curing the Lyme disease didn't fix the problem, right? So we've had to, in years, I have had to treat my mental health conditions with medicine, psychiatrist, psychologist, therapy, behavioral modification, thought changes, cognitive behavioral therapy in conjunction with medication therapies. And I will say, again, as Brian Fallon mentioned yesterday, normally all of the, I had some anxiety and depression too before we got to the figuring out the bipolar. Lots of the normal first line therapies did not work for me, which is very common in Lyme disease patients. But we did stumble upon lamotrigine, which, if you know, again, is an epileptic drug. So, which is why I said we decided to try a ketogenic diet, because our sort of outside the box thinking was, well, if that works for epilepsy and that drug worked for me, maybe it works for me. And it does. But I still have to deal with that. I have to deal with mood changes and anxiety and the OCD. It's not life-threatening anymore, but I will say, Virgie mentioned her depression. I will say there were nights when I was circling the drain, sobbing to my husband, I cannot live like this. I cannot live like this. What would I have done if I didn't have a family and 4 kids? How would that have ended? I don't know. So it lingers. It's gotten better. And I think part of that is over these intervening years with all of the treatments we have thrown at this and all of the lifestyle changes that I have made, stress management, sleep are huge for me. I'm doing everything I can to heal my body. So in those intervening years, I think my brain has somewhat healed itself a little bit. There's some capacity there, and I've learned how to manage my conditions externally. So I don't know if that helps, but.
Do you want the panel to address lingering symptoms or mental health?
Oh, absolutely. Yeah. As I mentioned, Dan mentioned, the combination of Tarly's sudden, very painful death from melanoma, and then losing my own health and the possibility of it being even more severe than it turned out to be, plunged me into a profound, life-threatening depression. And I'll say, to qualify that, I'm a child abuse survivor. I've been depressed before. I have suffered before. And even still, this was profound and terrifying. At one point, I was writing in my journal one evening the phrase "live through this" over and over again to motivate myself to keep going, particularly for my kids. And I'm very grateful that I have recovered from a lot of that. I have a fantastic therapist. I did try antidepressants, and unfortunately, my depression is fairly treatment resistant on that front. But I also have wonderful self-care tools. I'm a lifelong journaler. I live near a beautiful park and take frequent walks there. I have a fantastic family and supportive friends, and have healed greatly. I will say that I am a different person than I was before Tarly died and before I got Lyme disease. And my life is in some ways still catching up to the person who I am now. I, at that time, before Tarly's cancer returned, had my own business, and business was booming, and I was extremely ambitious. And I saw myself as being an agency president who would perhaps eventually have multiple employees. That is not my priority anymore. My priority is to live with as much health and peace and comfort with my family for as long as possible, and work supports that.
Adam, anything to offer before we move on in that regard? Mental health?
I think that anytime you have chronic symptoms that are ongoing, I mean, that's something you have to work through on a daily basis. You know, for me, I have a lot of tendinopathy and myelopathy. I'm very achy, and a lot of the things I used to be able to do, I just can't do as much of them. So you have to, there's a lot of activity modification and a lot of mentally that's hard. Like I've got buddies who love to go running, and I had a friend who just talked me into doing a 10K, and I still run every day, but I did it. And for 2 weeks, I couldn't walk afterwards. That would have never happened before. So I mentally had to work myself up to being able to just doing the things that, normally physically you'd be able to do, or you kind of stagger what you're going to do around the house. And it's like, I mean, as somebody who's 42 years old, I don't really feel like that all the way should be happening sometimes.
Yeah. Brian.
Yeah. First, I want to ask, are there any ID docs in the audience? I didn't see Chris. I got Wes. So that's and then maybe Chris is on Zoom. Okay. This is great. And then maybe Monica can comment. Ryan, I know we talked at dinner the other night, and your symptoms from that rapid progression to that rapid response, I mean, it sounds like a relapsing fever. And we've talked about Borrelia miyamotoi being spread by that hard tick. And I would like to get comments from maybe Chris or Wes, or I know, Monica, you've done non-human primate models in the relapsing fever realm.
You can bring that mic right back to him if he can answer now. Or anybody on Zoom that's listening. Chris, can you weigh in?
I actually never even got clarity from my primary about what had been going on with me, other than having my primary care say to a student, well, he's a very interesting case, after I was leaving the room. So if anyone can give me clarity, I'm open to it.
I'll add one more thing. We did once pull a tick out of our daughter's cheek and immediately sent it into the lab for testing, and that tick tested positive for miyamotoi.
Wes.
Yeah, no, I think that's really interesting. And hi, I'm Wes Kufel. I'm an infectious disease pharmacist at SUNY Upstate and Binghamton University. But no, I think that's a really good point that you bring up. And I just think that there's not really awareness of what Borrelia miyamotoi even is, and how to test for it. And so I think it really goes unrecognized. But luckily, there are some testing that we have at SUNY Upstate that we do. It's a Tick-Borne PCR panel that tests for a lot of different tick-borne pathogens, excluding Borrelia burgdorferi, which causes Lyme. So, and Borrelia miyamotoi is in that testing now. So it's definitely made recognition a little bit easier and better.
Hey, Wes, this
Does that
is,
answer your question, Brian?
can you guys hear me? This is Chris Polino.
Yeah, is Chris, what do you got here?
Chris commented that high fevers make him think of Anaplasma, Borrelia miyamotoi, and Ehrlichia.
Can you hear me?
And you have a couple questions, but we can continue with the discussion if we prefer. All right.
Yeah, and I'll add that at the time they said it might be Ehrlichia.
Okay. One of the questions from before was, for the first doctor that spoke, since you were already prescribed Doxy, if diagnosed sooner, what would have changed? What is the recommendation now?
If I was prescribed Doxy early on, I probably wouldn't have had the mental status issues. I certainly wouldn't have had the progression of the meningitis. I don't think that I had, and the carditis got a lot worse as well. And I also have to wonder if the recovery period wouldn't have been shorter, just catching the illness earlier. The other thing that I didn't mention, and I almost hate to mention it in a way, I mean, it's one of those things when you start talking about your bowels, that means you're getting old. But one of the symptoms that I did experience that I think potentially it could have helped tremendously was the constipation. And if you ever moved your bowels once a week for about 3 months, it's pretty horrible. And it got into my guts. And finally, after 3 months, things got back to normal again. But I have to wonder if maybe some of those symptoms might have been helped, by treating it sooner.
And then one more question from Zoom. They've been talking about some of these adjunct therapies, and one of them, Kathy S., was wondering about oxidation therapies and ozone in particular.
Ozone or oxidation therapy. Anybody have any experience with that, or anybody out here had experience with that? Ozone therapy. It's out there. My son tried it once or twice without much success. Is that it from Zoom land for the moment? Okay, Dr. Tangamani.
This is for the healthcare providers who are listening in or here. So if a patient comes to you with a tick and they either pull out in your office, you send it to a tick testing, or they come with a tick testing report, would you consider that as a risk and then prophylactically treat the patient, or you would ignore it?
Start with Dr. Seeger.
So if somebody comes in with a tick, and if there's any uncertainty about how long the tick has been attached, I automatically would treat that. I mean, if I don't start splitting hairs, if it's 24 or 36 hours, I mean, if there's uncertainty, I treat it. If there's absolute certainty that it was only just crawling on them, it wasn't attached, I may tell them just to watch it and wait and see. I think I probably use more of the IDSA, guidance in that regard. I probably err more towards that with a 200 milligram prophylactic dose of the doxycycline.
Anybody else differ with that?
But I'm pretty liberal with that. If there's any redness, I'll go longer for sure. Any suspicion, I'll go longer.
No one else wants to weigh in. There are other questions for this panel or comments. Weigh in the up front with Dr. and then weigh in the back. Dr. Lockhead.
Yeah, I have a comment and a question. First of all, mentioned at dinner the other night, as a medical educator, what should I drive home? And listening to you guys, I'm coming up with test questions in my mind. So I really appreciate, this is the best way to learn what our future doctors need. So I appreciate that. My question is, as a researcher, tell us what we should do. Tell us what we should focus on.
I mean, this is, I happen to work in and around the world of government funding and politics. But one thing that I know that is top of mind is, there are resources that need to be allocated. So I think as much as anything, the issues that most need addressing are, talking to the people who are writing checks, people who are serving in office, to say this is an important issue. And as we heard about in our presentation this morning, it's only going to become more so. So educating individuals, educating new doctors, educating existing doctors, educating the public at large, educating policy leaders that this is a problem that exists. This is funding that is needed, is essential if we're going to move forward and have these stories become anything less than horrific.
I would say working on developing multiplex panels that are accurate, reliable, and have good sensitivity and specificity. I think that would be key.
Detection
Agreed.
early.
I agree with Adam. I mean, we need a direct test, not an antibody test. We know that's just terrible. And then I would say the other thing, and some of the things that you, Monica, Brian, some of you are already looking at, but what is going on with that 15% or 20% or whatever? There is what is different about me that 2 months of doxycycline didn't work, right? What is that? What is the differential in my DNA, in my immune system, in past trauma, in gut health, which we talked about? We know, what is that factor? And my guess is it's multifactorial, right? There are a lot of combinations there, but if we could unlock why some patients don't recover, I think we'd be having a completely different conversation, right? Because the one issue is, right, accurate diagnosis, quick treatment, but we're still going to have those people who aren't going to recover. So that would be, that's top of my mind, because those are the people that I get the calls from. Those are the people who 20 years later, their life is still devastated. Those are the children as adolescents that are diagnosed with this, whose lives are devastatingly impacted. Lives are ruined by this disease. And that is generally because of the people who don't recover. They're part of that 15%.
Yeah. Two in the back of the room. I think two people had their hands up.
My name's Stephanie. I'm an industry partner in medical affairs. Thank you for sharing your stories. Very powerful. Along similar lines, but I want to go back to before the tick even encounters an individual, and maybe now knowing what you've gone through as well as clinical expertise. How can we help build awareness for individuals? So knowing where the burdens exist, living in an endemic area, coupled with an individual's individual risk in terms of exposure, and I know Royale touched on this, what are some ways that you think we could help in that helping patients decipher what their own personal individual risk is in whatever it is that they're doing on a daily basis to build awareness and education? That's a big question.
I would say, Adam may answer this too, so I'm going to give the microphone to him. But I would say we need to amplify partly what we're already doing, right? What we do as the Central New York Lyme and Tick-Borne Disease Alliance is this, right? We're educating providers, but we're also educating the public to be more aware. So making people understand that unless you're standing in the middle of a paved parking lot, you are at risk. Your children are at risk. So I think making this top of mind, as Brian mentioned, sunscreen, seatbelts, right? It just has to be part of the normal lexicon. Well, that takes behavioral, societal behavior change, right? One thing I'd say is we've talked about this internally. You got to start young. You got to start young, right? I shamed my father into wearing a seatbelt because I learned to wear a seatbelt. My children shamed my husband into sunscreen because, oh, Dad, we learned at school we're supposed to be wearing sunscreen if we go out, right? And so I think we have to start young. I think we have to start in the school level. We need to be talking with children, partially because I think when you teach a child, you teach a whole family. And also, as you know, Brian, I don't know if we talked about it this year, but I know the higher risk age groups are children and we'll say senior citizens. We'll say, oh, retirees. There you go. Arguably people who have spent more time outside, right? The kids are rolling around the grass, they're doing the things. And maybe when you're retired, I'm sure going to be spending a lot more time outside, right? So I think we also need to be remembering that we need to be targeting our outreach to especially those audiences. But I think it's understanding you're at risk always. It's getting people to understand that if they take simple, proactive measures, right? Being aware, long pants, long sleeves, wearing tick repellent, the tick checks. If you do nothing else, please do the tick check, right? For all of you, you come inside, check all of your kids, check all of your pets. I can't count how many ticks my dog has brought into the house. And we've sent a bunch of them, probably bankrupted single-handedly Seraphon's lab. He knows because he gets a text. I'm lucky enough to have Seraphon on speed dial. So I think all of those things, take these measures. So I think it's a difficult question, but it's the question that I think has the most impact, right? Because we've said that the research is great. New diagnostics are great. Better treatments are great. But the easiest way to treat tick-borne disease is not to get it in the first place. So I think if we put more effort toward public awareness and outreach and education, I think we can fix the problem that way by, sort of minimizing it.
Ryan, did you have something to add at the end?
No, just one. And we talked earlier how, as long if you're on, unless you're on a paved parking lot, you are at some risk. I do think that, as we've sort of going through the COVID pandemic, I think a lot of us became much more aware of, levels of risk and where we're at more risk and where we're at less. And, having gone through this experience, my wife going through this experience, I've learned a little bit about, tick habitats and behavior. I know that when I got my tick bite, my children we found ticks on them, all occurred while our dog was still alive. And he would run around in our backyard, get into the goldenrod that was growing up on the side of the yard, come back with all kinds of seeds. And that's when we saw ticks crawling on the floor, crawling on our children. I've cut the grass more. I've cut the weeds down. That has reduced the prevalence of tick spotting in our home. I mean, it's just there are things that we can reduce those risks by, where we walk. When I go for hikes in the Adirondacks or, in Ithaca, I'm much more likely to find a tick if I go off trail for any significant period of time. So I think understanding even just there is the full safety of, this room, or there is the, high danger of going off trail at Green Lakes, but understanding sort of between here and there, what we can do to mitigate the risks as, a layperson, as a non-medical professional. I know the days that I need, if I go gardening, I'm going to take a shower as soon as I get back inside, just to try to wash anything that might be off. If my wife and I went for a walk in our park the other day, put on bug spray because, even though we're walking on a mulched path, you just never know.
Back, and then we'll go one Zoomer.
Yeah, Catherine Dokas, PA, currently work in urgent care. Were any of you ever offered any additional testing other than the standard, sadly inaccurate Western blot, like IGeneX?
Not until I was hospitalized.
Why did anybody else offered testing at a different lab? Why do you ask about IGeneX, doctor?
Well, I mean, I'm familiar with IGeneX. I mean, it tests in a different way. It's PCR. It doesn't rely on sad immune systems that can occur in Lyme patients. So
Yeah.
I did have PCR testing and it was all negative.
From
Yeah.
IGeneX?
I don't know where they sent it to, but it was all PCR
I mean,
testing. It was
my
negative.
son had Lyme and Bartonella, and nothing picked it up except IGeneX.
And I know there are practitioners, though, who don't trust IGeneX as much as you might. And I've had direct experience with that with our son, that it's, I think
And
it's,
there's others. I mean, there are other labs as well, but
yeah.
I mean, it's an expensive test. Medicare covers it. Some insurances do. Sadly, mine didn't, but
Right.
I'm glad it was an option for us.
Zoom, we need a microphone. I'll grab it.
I got it. Okay.
Thank you. These are just some comments in response to the question about what research people would like to see. Deborah Tooker just commented that they would like to see treatments that work. And Jennifer Platt, Dr. PH, representing Tick-Borne Conditions United, said that there are many patients with other tick-borne diseases like ehrlichiosis and rickettsias who are also not getting better, or who have returning and worsening of symptoms over time. And she just asked that the researchers to please keep these people on their radar.
Yeah, the co-infections are a whole nother story sometimes. Somebody else have a hand up right here? Yeah.
Hi, Christine Herb. I come here as a mom of a daughter who is 33 years old and has been completely devastated by Lyme, Babesia, and Bartonella. We think that she had it for 20 years, spreading throughout her body before it was diagnosed 4 years ago. We identified that through testing that was positive for Bartonella and learning more about Bartonella. One of the heralding signs is purple striations on the back. And when she was a young girl, she had these purple marks across her back like somebody had whipped her. And I asked her who was hurting her, and she said no one. And I looked closely and they look like stretch marks. And it was on her lower back. And I thought, that's so odd. I've never seen stretch marks like that, and especially in a child. But in my ignorance, you know, we're talking the late 90s. I'm a nurse. I'm like, oh, she's off the growth chart. She's always been tall since birth. And so her skin isn't keeping up with her growth. She's just growing so fast. Well, that's silly, right? I mean, if she's genetically going to be tall, her skin's going to keep up with her. But it wasn't known, and so it was ignored. And then slowly over time, different ailments have come up. The early ones were anxiety and depression, but she was a pre-adolescent. And so we just chalked it up to that, and some mental history in the family. And she's complaining of joint pain, leg pain. I'm like, it's growing pains. You know, we all grew up with that, right? It's growing pains. And so
turned out to be Bartonella, you said, that caused all
that was one, Lyme and Babesia. Fast forward, she's seen multiple providers, all different specialists, was treated with disbelief, and the experience of not being believed is devastating, and we need to change that. We need to be listening to the patients, because it just contributes to their suffering.
Yeah, I think the panel echoed that early on, right?
Right.
And probably would underscore that now.
And
correct?
to mark on the difficulty with insurance and how there is an unfairness based on insurance. My daughter's insurance is Medicaid. And so try to find a Lyme literate doctor who accepts Medicaid for payment. You won't find it. Luckily, I have the resources. But the last thing I want to point out is because we don't have good testing that is accurate throughout all the stages of infections, because we don't have treatment guidelines, because the research hasn't been done, this title of post-treatment Lyme disease is a misnomer. There is no, how do we know when treatment is ended? What is treatment?
Well, you've raised a lot of questions. I don't think we have the answers. Do you have a
Right.
question for the panel? Because I know.
No, I just
Okay.
wanted to make we don't necessarily know what treatment.
We don't.
We
And if
don't
we could
have that.
answer half
So
of the questions that you
post-treatment.
just posed, we'd be in
Yeah.
good shape. Behind you, in the row behind you, please. Thank you, Kristen.
If I could just make a comment on that. So the one thing I mean, it keeps seeming to come back is that our diagnostics aren't as good as they should be. You know, and I think we all agree upon that, but I do think, you know, coming back to it, if we make the diagnosis, you know, our treatments aren't bad. They're not great, but they're not bad. And I think a large part of it comes back to the fact of making the diagnosis. So I think if we really try to focus on the stuff that we can, at the current time, I mean, obviously the diagnostics are going to take time to come along. But I think focusing on the diagnosis and how we can really, you know, try to nail that I think that would be as providers, I think that's something that we could really try to work on.
Yeah, next question there.
Yeah, I'm hearing a whole lot about physician education here. And first of all, I'm going to comment on Bartonella. Bartonella, the complex, difficult, life-threatening manifestations were originally noticed during the HIV epidemic because immunocompromised patients were getting these horrible manifestations. And what I think, we're seeing a lot of Bartonella in Lyme patients as well. And it doesn't mean that it's necessarily transmitted by ticks because the prevalence in ticks is not very high. But I think those patients who are immunocompromised are beginning to have complications from Bartonella, which is ubiquitous. And so we're studying this in my lab as well. And it can be a cause of fever of unknown origin. And it turns out it's really, really hard to kill with antibiotics as well. We're trying combination therapy against Bartonella. Everything we're talking about with regard to tick-borne disease falls under the auspices of One Health. And I don't normally recommend providers, but I have been working with this organization called Invisible International, and they provide free physician resources, free education. They have these wonderful health assessments, everything that you're talking about with, do you have a dog? Do you live in the woods? All these things that need to be asked when it comes to tick-borne diseases. So I'm going to go ahead and put a plug in for them. Yeah.
On the far side of the room, Elizabeth, she'll get a microphone to you. Hold on.
Hi, everyone. I'm Elizabeth Presido. I was on the patient panel last year, but you guys touched on this briefly, and I was just wondering if you could talk about nervous system work and stress reduction, and if that's been of any help, or any suggestions too you could share with the audience would be great.
Nervous system work and your own stress reduction techniques.
Do you have something to add, Virgie? I'll let you go.
Yeah, I ended my consulting business and got a full-time job with an employer who supports work-life balance. And that has been critical. Seeing a therapist, critical, and then also doing internal self-work and digging into the ways in which my cousin's passing and Lyme disease have changed me, and honoring those. And I also do some breath work, and I've thought about whether or not to try to find like a somatic yoga practitioner, but have not actually pursued it yet. But it's really critical to do whatever work works for you when you've experienced such severe illness.
Yes, I'll say, Elizabeth, I live in this world, as I know you do, and I have found it extremely valuable. So I do all of the self-care things, but I also breath work. I took up meditation, which, let me tell you, was difficult for a type A mind, but I needed to do everything I could to calm my nervous system. I learned about the vagus nerve, and I do vagal nerve stimulation. I do, like I said, the meditation and breath work, those sorts of things. I've looked at tapping, EMDR, like all of the, whatever I need to do to calm my nervous system. I mentioned sleep is huge, huge, huge priority for me. I'm just, everything goes wrong. And unfortunately, as one of the post-treatment impacts, especially when you have neurological complications, I've suffered from insomnia for a very long time, sleep maintenance insomnia, to be specific, right? So I've had to do everything I could to improve my sleep. So I would say I do all of those things. Stress reduction is huge. I'm trying to think. So I eat in a way, I conduct my life in a way, I cut out everything that was toxic. I don't do drama. Before I came here, I left, I have had toxic jobs. I've had to change careers. I've had to cut out toxic people. I don't get up and listen to the news. I do not pay any attention to the news in the evening. My husband knows. We don't talk about anything serious after dinner.
Well, the news isn't all toxic.
It is not all time. It is not all. No, but we tend to focus on sensationalized. And so basically my husband is a news addict. So if there's anything serious going on, he'll let me know. So that's just how
I
we've
used
set
to
it
be a
up.
news addict.
I know.
I've broken the habit.
When
That's recovery.
when you have what I would consider hypervigilance,
Yes.
right? I would consider that when you've gone through this sort of thing and you get to the post stage, I think we need to consider that it's traumatic, right? It was traumatic for me. And most of the long-term patients that I have talked to have a form of PTSD. And so the whole thing is traumatic, mentally, emotionally, and societally, and everything that happens. So you sort of got to treat it like that. I'm healing that trauma. So I'm setting everything in my life up so that I'm even and I can conserve all of my mental and physical energies.
Thank you for sharing that. I know some doctors asked if you, I would add, if you get patients that maybe are a bit further into whichever co-infections that they have with Lyme, definitely help them share stress reduction, somatic work, anything they can do to really calm their nervous system. That's going to help them be more receptive to treatments and also be able to navigate and advocate for themselves more easily. So just things like sleep hygiene, lowering stress in their lives, basic things a lot of GPs can help with. I think that will go a really long way to helping them get back to the basics so they can be better set up for a lot of treatment ahead of them.
Well, that's Elizabeth Rosito, who knows what she's talking about after years. She was on the patient panel last year, and I think she'll have the last word today, unless there's another question, and there is. No, go ahead. Sure. This is too important to cut short. We do have a coffee break coming up, but we can drink our coffee quickly.
I'd be happy to be the last person. I don't have a question. I want to convey my incredible respect for all of you for sharing these stories, because it obviously is deeply traumatic to relive the journey that you went through. And I want to share my admiration for all of you have completely changed your lives. And as you said, they were derailed from what you thought they were going to be. But it seems like you've all come out on top as amazing people. And I especially want to applaud you, because you have now dedicated your life to making sure this does not happen any more than it already is, and to try to improve things for everyone else. Thank you.
And there's one more. You can applaud. No, go ahead.
Hi, my name is Alyssa. I'm a geriatric NP here at Upstate. Royal, I do thank you for touching on older adults in part of your talk. This could also be for anyone in the room, but just like any differing presentations in older adults who usually don't, produce typical symptoms of presentation. Just feeling that this might be more undiagnosed in older adults, perhaps.
Who can answer that? Presentation of these disease. Oh, go ahead, doctor. Sure.
Some of the, I had a gentleman, he must have been about 2-3 weeks ago. And he was working at a paper pulping place, and he's a farmer by daytime and does that on the side. And basically he had fallen because he passed out, and it was real hot in the room. So they assumed it must have been vasovagal syncope. Long story short, went to the emergency room, got better from that standpoint, but his back was giving him a horrible time. And to the point where I actually thought he might have caught equina, his low back. And so I did an MRI, and he had real tight spinal stenosis. But then he came back 3 weeks later with a pretty profound Bell's palsy. So, even though he had all the cardiac workup, I think if you have unexplained syncope or cardiac issues, I think that's one thing you may want to think about as well. That was kind of an atypical presentation there.
Yeah. Oh, yes, please.
If I could take my Alliance hat off, and, our son Jonah, is 24, has had it for 6 years. Thankfully, is an educator with the Alliance. Thank you for that. But my question may be unanswerable, but we're both parents. We've walked with him and journeyed with him. And every day, we text and just give hey, what's up? How are you this morning? And he was here yesterday. And so he's going to a wedding today. And I said, how's it going? He said, woke up with terrible sweats. I'm in a flare. Just say a prayer for me that I can be a nice date for the wedding today. So we get a lot of those, right? So I guess my question is, as a parent and as family, how do we continue to be that support that provides hope? And that might be unanswerable, but I'll toss that to you.
Ryan?
I mean, that kind of is the question. I don't know if I have a good answer. Having witnessed this in myself, witnessed it in the person I love most in the world other than my children. All we can do as people is to bear witness and not look away, to let someone know they are not alone to the extent that we can, to listen, to try, and to do better. That's all any of us can do.
Virgie?
Yeah. Obviously I echo what Brian says, and I'll also add a slightly different angle. I don't know if enough is said about the impact of Lyme disease on the patient's families. At the time of my hospitalization, our eldest was 5, about to turn 6. Because I was ill, I was not able to attend her kindergarten graduation. I could not get out of bed. And when I was hospitalized, she too was living with the trauma of her Auntie Tara's death. And so she asked Ryan, is mommy going to die? And when I talked to her while I was hospitalized, she was crying and told me on the phone, it's hard to be a daughter without you. And I think daddy is doing too much. So we ourselves as patients are traumatized, and then our families who love us are traumatized along with us, and they also require support. So I hope that you two are also getting the support that you need as the parents of Jonah.
Doctor or
I don't think I could have said
yeah,
it better.
I don't think,
Yeah.
yeah.
I mean, it's hard. And I think that is something that I think we do need to talk about more, right? This impacts everyone. This, just like any other serious chronic disease, right? It impacts the entire family. It can impact family dynamics, sibling dynamics. I know this, right? With lasting impacts to the relationship. I'd say, I think it is especially difficult to parent a child with chronic illness. It is especially difficult in that role. I think one, like Ryan said, I echo everything that Ryan said. I mean, I think we treat it like we treat it. Okay, so what partly makes this very, very, very difficult, because I've talked to a lot of parents, is this is invisible. This is an invisible disease. You don't know until your child says to you or indicates, you don't know from one day to the next how they're feeling. It's very hard because it is invisible, right? So it's that ongoing dialogue, which I know you do well, but I think it is very difficult, especially when your child is young adult. And we've talked about this. There are so many of these patients, we're talking adolescents in that, 16 to 25 age, who get this and who are really struggling and who have a very strong mental health component too. And I think those are difficult conversations because you have a child that's on the edge of adulthood.
Right. And our next presentation after this brief break is about pediatric Lyme, but I'm glad you asked the question. I'm glad you've all commented, because it's invisible, because on any given day, Jonah and any of you and anybody else, you look, oh, he looks so good. He's having a good day today. He was here yesterday. He's got a job now. He's going to a wedding tonight, and he may pay for that for the next 2 weeks in bed. So anyway, you've been great. Real briefly, I want to give Coffee chance. All right. Oh, yeah, always.
It is the second Wednesday of every month.
at the Janesville DeWitt Library, and all are welcome.
That's the second Wednesday of every month at the DeWitt Community Library on Jamesville Road, not far from 481, the support group. Okay, we got a break, and I'll be back here shortly after 11.